Module 1. Medicare Eligibility and Overview. Introduction. While Social Security was established in the 1930s to protect retirees from poverty, it wasn't until the 1960s that federal programs were enacted to ensure health care to seniors. As part of the Great Society program of President Lyndon Johnson, Medicare was signed into law on July 30, 1965. The program insured 19 million Americans in its first year, with an initial budget of about $10 billion. Medicare now insures about 56 million people, and its budget has swelled to almost $600 billion annually. Medicare spending represents 15% of the federal budget. In fact, almost 1 in every $5 spent in healthcare in the United States is spent by the federal government on Medicare. Since being enacted, Medicare has undergone significant overhauls in every decade. In 1972, Medicare was expanded to cover some disabled people under age 65. The 1980s saw the addition of Medicare supplemental insurance under federal oversight, the addition of hospice services to Medicare benefits, and other rules to make Medicare more affordable and comprehensive. In the 1990s, Medicare Advantage was created to enable various Medicare benefits to be administered efficiently under comprehensive policies. In 2003, Medicare Part D was added, to add optional prescription drug benefits to Medicare insurance plans. In 2010, the Affordable Care Act included several reforms to contain Medicare costs and make the system more efficient. Despite occasional problems and continued tweaking, Medicare remains one of the most popular federal programs, as opinion polls consistently show that majorities of Americans support the program. Though Medicare remains an exceedingly complex system, in this course we will demystify this sometimes Byzantine network of rules by first presenting an overview of the Medicare framework, including eligibility and coverage, and then focusing on the minutiae of the costs, benefits, and responsibilities of the system's users. The 4 parts of Medicare coverage. Medicare is administered under 4 parts that were established by 3 different pieces of legislation over the course of 4 decades. Today, the 4 parts complement each other to comprise the Medicare system. Medicare Part A covers inpatient care at hospitals, nursing home care in some cases, hospice care, and some forms of rehabilitative home care. Part A is sometimes referred to as hospital insurance. Part A is free for most eligible retirees. Medicare Part B covers doctor visits, outpatient care, medical equipment, preventive services, and services from other healthcare providers. Part B covers what we generally think of as being covered by health insurance. Medicare under Part B is heavily subsidized, but does require the payment of premiums, which vary based on income. Medicare Part C governs the administration of benefits under Parts A and B through private insurance companies that follow rules set forth by the Medicare statutes and regulations. Part C is also referred to as Medicare Advantage. Part D covers prescription drugs, and also requires the payment of premiums, though, like Part B, these are heavily subsidized and far below market rates for the benefits that they provide. Eligibility. American citizens and lawful permanent residents, green card holders, are eligible for full Medicare benefits if they have earned 40 Social Security credits. A person earns the Social Security credit by earning a threshold income that's subject to payroll tax in a given year. The threshold amount increases each year based on national wage averages, and was $1,320 as of 2018. A person can earn up to 4 credits per year, so a person who earns at least $5,280 per year as of 2018 earns 4 credits towards the Social Security and Medicare thresholds. Thus, 10 years on the workforce is usually enough to earn full Medicare benefits. Spouses of people who have earned 40 Social Security credits are also fully eligible for Medicare. People over age 65 who receive Social Security benefits or comparable benefits from the Railroad Retirement Board are automatically enrolled in Medicare Parts A and B. While Part A is free, the Part B premiums are deducted automatically from the recipient's Social Security benefits unless she opts out of Part B. People under age 65 can also be eligible for Medicare if they are disabled and have been entitled to Social Security disability benefits for at least 24 months, which need not necessarily be consecutive, or receive a disability pension from the Railroad Retirement Board and meet certain conditions, or have amyotrophic lateral sclerosis, or Lou Gehrig's disease, or have permanent kidney failure requiring regular dialysis or a kidney transplant, though this last possibility has certain Social Security tax qualifications. People over age 65 who do not qualify for the full Medicare benefits because they did not earn the full 40 working quarter credits and do not otherwise qualify may still choose to enroll in Medicare, though they will be required to pay premiums even for Part A, which is typically free to those who qualify. They can choose to do so as soon as they reach the normal initial enrollment period for Medicare. The premiums that non-eligible people pay for Part A depends on the number of working credits that the person earned and varies from year to year. As of 2018, people who paid Medicare taxes for at least 30 quarters and thus earned at least 30 working credits must pay monthly premiums of $232. People who earn fewer than 30 credits must pay monthly premiums of $422 for Part A. People who choose to sign up for Part A when not eligible for full benefits must also enroll in Medicare Part B. Timing. The timing for enrollment in Medicare varies depending on the status of the applicant. Those who are not automatically enrolled in free Part A can sign up for it during the initial enrollment period. This is the 7-month period that starts 3 months prior to the month that the applicant turns 65 and ends 3 months following the month that she turns 65, including the month of her 65th birthday. The start date when coverage takes effect depends on when during the enrollment period that the person enrolls. If she signs up during the first 3 months, coverage starts on the first day of the birthday month. The start date of coverage is delayed for people who enroll during their birthday months or during the subsequent 3 months. People are strongly advised to sign up for Medicare during their initial enrollment periods to avoid paying higher premiums. However, a person may be eligible for a later special enrollment period during which he may enroll without penalty. A special enrollment period may be available if he's covered under a group health plan in his or his spouse's current employment. The applicant may then choose to sign up for Medicare anytime he's still covered by the group health plan, or during the 8-month period that begins the month after the employment ends, or when coverage ends, whichever comes first. People who are covered under COBRA, retiree health plans, and individual health coverage are not eligible for special enrollment periods when their current coverage ends, as those types of coverages are not considered to be based on current employment. People who do not sign up for Parts A and or Part B during their initial enrollment period and do not qualify for a special enrollment period can sign up between January 1st and March 31st each year. The start of coverage will be delayed until July 1st of that year, and a higher Part A or Part B late enrollment premium may be imposed. Medicare rights, denials, and appeals. Medicare beneficiaries have certain protections, including the rights to be treated with dignity and respect at all times, be protected from discrimination, have personal and health information kept private, get information in a way that they understand from Medicare, healthcare providers, and Medicare contractors, have questions about Medicare answered, have access to doctors, other healthcare providers, specialists, and hospitals, learn about their treatment choices in clear language that they understand, and participate in treatment decisions, get Medicare-covered services in an emergency, get a decision about healthcare payment, coverage of services, or prescription drug coverage, request a review of certain decisions about healthcare payment, coverage of services, or prescription drug coverage, and file complaints, including complaints about the quality of their care. Medicare benefits are typically administered by private health and prescription drug plans who choose to participate in Medicare. If a plan suspends its participation in Medicare, people covered under that plan may select other plans during the Medicare open enrollment between October 15th and December 7th. Coverage under the new plan begins the following January 1st. Like other health and prescription drug plans, Medicare or associated Medicare plans may limit or deny coverage or payment for a submitted claim if the claim is not covered. This could include denial of payment for healthcare services, supplies, or prescription drugs, and includes reversals of coverage for already paid expenses. If this occurs, the Medicare beneficiary has the right to appeal the decision. The dispute may, for example, pertain to the shares of payment for which the beneficiary is deemed to be responsible. The procedures for filing an appeal depend on the type of Medicare coverage that the patient has, with some differences between those covered by original Medicare and those who have a Medicare Advantage plan. The main differences impact the time frames for filing an appeal and depend on the nature of the plan. For original Medicare, which is Parts A and B, the item under dispute will be identified in the Medicare Summary Notice. The patient must indicate which items she wishes to dispute, explain the reason for her disagreement, and send the information to the Medicare Administrative Contractor. The appeal must be filed within 120 days of the date that the patient received the Medicare Summary Notice. A decision is generally received from the coordinator within 60 days after it gets the request. In the case of prescription drugs, the patient has the right to get a coverage determination from his Medicare drug plan even before the drug is purchased. This is a written explanation of the plan's decision about whether the drug is covered, whether the patient has met the plan's requirements to have the drug covered, and how much the patient will be required to pay for the drug. The patient may ask for an exception to the plan's rules and to cover the drug, such as if he or the prescriber believes that he needs a drug that is not on the plan's list of covered drugs, or that a coverage rule should be waived, or if he believes he should pay less for purchasing a higher tier or more expensive drug if he cannot take any of the approved lower tier or less expensive drugs for the same condition. Depending on the plan, the patient or the prescriber may make a request for a coverage determination by phone or in writing. They may ask for an expedited request if the prescription has not yet been filled, or if the prescriber tells the plan administrator that the life or health of the patient may be at risk by waiting. If an exception is requested, the prescriber must provide a statement explaining the medical justification for the exception. An expedited appeal may also be requested if the patient or provider believes that the Medicare-covered services are ending too soon. An independent reviewer will decide if the services should continue. If the patient requires assistance in filing an appeal, she can appoint a representative to help. This can be a family member, friend, advocate, attorney, doctor, or anyone else who may act on her behalf. She may also get help from the applicable state health insurance assistance program. In the rest of this course, we will take a look at the various choices that are available when selecting the right type of Medicare coverage, and on the coverages and benefits provided by the 4 parts of Medicare.